everyone, welcome to Science Friday.
Here's some for E as well. The one on the top here is one of the ways that you can define E.
What makes a field more likely to have an unbalanced gender distribution?
So this can be, like, in the case of this paper, gyrification or brain folds.
A neuroscientist started to look at the brain
computers, like the
more as an
network
interconnected
are very
incredibly negative
area.
They're parasites.
Hello everyone, my name is Charlotte Rosario and I will be presenting to you all today on affective brain-computer interfaces as enabling technology for responsive psychiatric stimulation, or if you speak English, the potential of brain-computer interfaces to tackle the mental health crisis. So everyone, I want you to meet 4-year-old Charlotte. The most peculiar and interesting thing that I could lay my eyes on was humans. And so I love to analyze people, ask the questions of nature versus nurture. Do you want me to continue? Or?
And questions of feedback and not
feedback. Yes, all questions. And asking about consciousness, what truly is our identities, is it our brains? And so you can imagine that as a young kid who had to witness actually a family member be diagnosed with a mental health illness, that the topic of neuroscience became ever so interesting. So I want to talk more about the mental health crisis and mental health illnesses. So there is a statistic that states 1 in 4 US adults suffer from a diagnosable mental health illness. So with such a big problem, we should expect a big solution. So my question for you all, starting out, is what are some current treatment strategies for mental health illnesses? Can we name any ideas? See some hands? Therapy, yes. So therapy is one of the ways people choose to address their mental health illness. Do we have any other ideas, though? Yes, go ahead. Yes, for sure. So yeah, drugs, medication, that's also another one of the ways. Can anyone think of anything else?
Mindfulness exercises.
There you go. You know all the ways, yes. So, yes, Dee, go ahead.
drugs.
Yeah, drugs, yeah. So, go ahead.
Drugs.
Yes.
Oh, nice one.
Yes, drugs, for sure. So what we see is that, okay, this is actually the older presentation. Sorry, wait, 1 second. Is it okay, since we're going off of the one-off keynote, right? Yeah. Sorry, okay, is it okay if we actually go off the, wait, this is, yeah, so what you're seeing here, this is a different copy.
Next week at Science Friday,
Thank you, Dee.
we will be presenting, Siddhartha Mukherjee will be presenting. He's the author of,
Is that it? Yeah.
he's a doctor.
This was the one on,
Excellent story.
yeah, we have to go.
And wrote a book about cancer with an interesting perspective. He presents it from the idea of the disease itself, the doctors who research it, the patients.
Possibility So that is where neurotechnology comes in. And when we think of neurotechnology, a lot of people end up getting this futuristic view of, something like the Matrix, things that are coming in the future. But really, neurotechnology already exists today and has been for many years. In fact, what you're seeing right here is electroencephalography, also known as the EEG method, and it's a non-invasive method of recording electrical signals inside one's brain. Now, this brings up issue number one with using neurotechnology to tackle mental health, is that for a user who is suffering from a mental health illness, wearing external hardware may not be as attractive of a treatment strategy. And then we get to the fMRI, also known as the functional magnetic resonance imaging machine. It's essentially a big magnet that you lie down inside of for a finite period of time. And so you can then deduce that because it's only a finite period of time, for a person who has a mental health illness that sporadically flares and remits, this may not be a sustainable way to monitor the illness. So then we get to implanted brain-computer interfaces, also known as the BCI. And how exactly does a brain-computer interface work? Well, as you can see here, this person has an inadequate emotion regulation communication channel between its prefrontal cortex and its symptom control region in the brain. So the brain-computer interface gets implanted to target the prefrontal cortex, acting as an affective decoding controller here. And it continuously monitors the brain activity and senses if the person is going to a trajectory towards a pathological state. This is like a dangerous mental state. When the brain-computer interface senses this, it can adjust parameters to then counteract that trajectory and keep that person in a healthy mental state. So implanted BCIs have actually been experimented with for the past few years now, and we see that with older brain-computer interface algorithms that it's been seen to be unable to distinguish between appropriateness of emotion. So we're talking about healthy excitement versus a traumatic flashback, and this could be in the case of a person with PTSD. So the paper's approach is to use this method of sensing and preventing, and this is through plasticity and volition. So what is plasticity in this sense? Well, plasticity is basically the ability for the brain to change itself to better match the brain-computer interface or the decoder. And to actually add this into the experiment, participants first perform a predicate task. This is something like a hand gesture or seeing emotional imagery. And then during this training period, a decoder is built to then get deployed to classify new brain activity as it arises. And during these tasks, the brain changes itself to better match the decoder. And then the second aspect of this approach is volition. So volition is essentially the person actually choosing to change the brain. And so if a participant senses that the current stimulation parameters are just not filling their needs, then they can intervene to actually alter the stimulation parameters through neuromodulation, like altering their own prefrontal cortex firing rates to then get the adequate stimulation and reach that desired mental state. What we're seeing is that with volition, participants can express personal desire directly and efficiently through an implanted brain-computer interface. So the proof of concept of the paper and what the question the paper is trying to answer is, can animals be trained to volitionally alter the prefrontal cortex activity in order to receive a reward stimulation? Now keep in mind, we're talking about animals in terms of rats. So it's important to note that this is not, with current technology for brain-computer interfaces, this is not anywhere near being applied to humans. This experiment is simply on rats because they have an exceptionally small prefrontal cortex when compared to humans. And then the paper is also specifically targeting these 2 electrodes inside the medial forebrain bundle of the rat's brain. And the medial forebrain bundle is the reward center of the rat's brain. So in order to actually test, can an animal train its own brain to alter prefrontal cortex activity, the procedures are first playing a tone or some sort of audio feedback to then give the rat 5 to 10 seconds to actually modulate its own prefrontal cortex. And this is in terms of the brain activity and firing rate to match this audio feedback. Now there is a target that the rat actually has to reach in order to reach and receive reward stimulation. And this reward stimulation would, be inside the reward center of the brain, so it would feel really good for the rat, and it'd be a really strong incentive. And then the interesting part where volition also comes into this experiment is giving the rat a choice to choose to initiate the next trial. I like to think about it like training a dog with a clicker. You are repeatedly clicking, giving the dog a clicking sound, and the dog can then associate this clicking sound with a reward of like a treat, and this trains the dog to actually do a task. And this right here is just a flow chart of how the neural data passes throughout the trial. It, of course, starts with the animal in the operant chamber, and it records the brain activity and does spike sorting. This then goes and determines the stimulation and the stimulation parameters, and then this is also stored in an external PC. Here is the actual brain-computer interface algorithm schematics. We see that this raw data correlates with the audio feedback that the rat hears, and this determines whether the rat will receive reward stimulation or not. Now the results. So we see here that in these graphs, the x-axis here represents the elapsed time in seconds. As you can notice, it starts at negative 5 seconds, and so this is just a 5-second period of recording baseline brain activity. And then the y-axis here represents spike rate, or just brain activity in hertz. We see with these blue lines, this represents the actual brain activity being monitored during this -5 to 10 second period of time. And the gray rectangle here represents the actual period where the hertz was played. So this is the audio feedback. And then shortly after, we see these red rectangles representing the amount of time the rat took to actually match its prefrontal cortex firing rate to the audio hertz here. We can see that in the top graph here, this is showing that the rat was actually successful in reaching that target. And so we see that the brain signals in blue actually overlapped with the red rectangle there. We see this lightning bolt as this does show stimulation occurred, and this happens, as you can see, around 4 seconds. And then you see that shortly after the 5-second mark, brain activity goes back to baseline. This is just due to fatigue. And then the graph below it here, which represents a scenario where the rat failed at receiving stimulation, we can see that the brain activity in blue never actually crossed into the red region. We can see that this red rectangle here is much longer than the one in the graph above. This is because the rat for the entire duration tried to reach that target but did not actually reach it. So it was successful. We see that all animals learn to control the prefrontal cortex brain-computer interface to trigger this reward stimulation. And this was over a 250 trial period. We see that even when the trial durations increase to be longer, we're seeing 20 minutes versus 5 to 10 seconds, we see that they were all still successful. And in only 20 to 40 minutes, because the rats would initiate the next trial, we see that they were actually able to learn this new skill of modulating its own prefrontal cortex in this period of time. But the most fascinating thing about these results is that it shows that the rats were able to develop an emotional communication channel with its brain-computer interface. So essentially, this whole volition aspect we see in the results, the rat was actually able to express its desire and its intention for more stimulation by actually remapping and modulating its prefrontal cortex firing rate. So what does this mean for humans, right? Because we were talking about rats here in this experiment. I would argue that humans are very different from rats. And the paper even says that, well, if a rat can do this, maybe humans can. And the thing is, the paper argues that rats, have exceptionally smaller brains than us. So if a rat was able to do this, then perhaps we can be the same in the future. And so if we want to think optimistically here that someday, humans will have these brain-computer interfaces implanted in their brains, then we see that for people with stroke and motor dysfunction, this can be life-changing. In fact, with this brain-computer interface, this may be able to increase functional connectivity between the spinal cord and the actual brain, allowing people who maybe are paralyzed to finally walk again. And then we see that for psychiatric patients, that if they're actually able to recognize their mental illness and do have a desire to suppress it, then they do possess the necessary volition to actually activate the stimulator of the brain-computer interface. And then the last thing I just want to add is when it comes to another mental illness like bipolar disorder, the brain-computer interface can help actually prevent the user from going down that trajectory towards a pathological state. This is like, the unhealthy mental state of bipolar disorder. So keeping participants or users in this unipolar healthy mood. So yes, affective brain-computer interfaces may someday help cure psychiatric illness. But the key word is someday. Again, humans are not ready yet to have these powerful pieces of technology inside their brains. Again, this was an experiment on rats solely. In fact, the paper even stated that these responsive closed-loop systems would expand the number of disorders treatable with an exciting but presently limited technology. Because if you actually take a closer look, think, 4 steps ahead after we actually implant these brain-computer interfaces inside our brain, we see that brain-computer interfaces may actually cause users to develop habituation. This is the scary part. Users may build up tolerance to increasing stimulation, meaning that they'll need an upwards dosage as time goes by. And then we see that brain-computer interfaces may also cause addiction. In fact, during these trials, they actually noted that some of the animals were reported to engage in dangerous tasks like avoiding eating food or putting their actual health in jeopardy just to receive that addictive reward stimulation. So, if that is the case, then are brain-computer interfaces just another form or another type of drug? We have to remember that as we go on with our lives, even in the rest of our day, in the future, as more technology will be implemented in our society and literally installed inside your brain, that we have to ask this question: is technology advancing or exacerbating? Thank you. Thank you.